Assalamu alaikum wa rahmatullahi wa barakatuh. A very good day to you and welcome to Life Matters, where every life matters. And inshallah, we will do our part 2 as we continue pediatrics, physiotherapy in pediatrics, the role of physiotherapists in pediatrics in the little ones. And our previous show we did with Asirah Ahmed, we welcome her back into studio. She touched on quite a bit that I didn't even think, was even possible when it comes to the little ones and how much the support they needed with regards to physiotherapy. So welcome back, Asirah. Shukran so much again for your time. We really appreciate it. I know that you have a very busy schedule and you had to just literally block out this time. And hopefully our viewers can once again benefit from the previous show. Just to recap, alhamdulillah, we did a bit of the milestones. Yes. We did the suction, not suction.
Yes, yeah.
Respiratory complications. And I think what I loved about doing that show was how you connected with mom and baby and how mom and baby needs to connect. Yes. And at the end of the day, whether it's just mom and baby, I mean, you've mentioned dad, during bath time, come along, be part of it because, that actually helps the infant, the toddler, the child develop better. So just to recap from our last show, leading to what we're going to be discussing today. We're going to do a bit of sports injuries. We're going to discuss the orthopedic musculoskeletal issues. Again, I want to talk about bonding, the importance of play. And yeah, just to recap to our viewers what they missed last time, and they can watch in our part 2. It will be uploaded on our YouTube channel, and then what we're going to discuss today, inshallah.
So the last time I think we spoke a lot about our kiddies that are growing and they need that one-on-one care from the parents and how to help them achieve their milestones. So sometimes they have a little bit of a delay in their milestones. And I think the one thing we spoke about towards the ending was when to worry about those specific milestones if they're not achieving it. And each child is so unique. So always, like I said, and I keep on preaching, work out the adjusted age. What is the actual age if they were born premature? And then which you do by basically subtracting, so if they were born 36 weeks prim, you'll basically minus that 4 weeks to their actual age. And then they're not a year right now. They may be now 4 weeks shy of a year. So in terms of milestones, it helps you just realize, don't panic. My child is still on the road to achieving their milestones. How can I help them and how can I facilitate that? Very, very important to understand that. And just the suctioning, which is something I love to do because it helps, but I don't love it because obviously of the trauma that it gives the kids. But like I always say, it's a balancing act. If you know the benefits of it, you do it. It just helps them breathe better.
So alhamdulillah, a lot we learned there, and I said, listen, we have to have a part 2 because there's still more to discuss in the role of pediatrics, the role physiotherapists play in pediatrics. So what I want to look at today with the little bit older ones, and yes, inshallah, we'll tap on to, the little ones as well, but sports injuries and those complications with the increasing activities that children are involved in. It does happen. Accidents is inevitable. So how do physiotherapy play a role in helping the child recover and also possibly preventing these accidents?
So you must remember when you were younger, we have all these budding soccer players, and nowadays it's these paddle players, and it's such a craze. And kids can be so competitive, and also their self-esteem is so fragile at the same time. So when they injure themselves, it almost feels like their whole world is coming to an end. I can't play soccer. I need to be able to compete. I need to do this and that. So we come in and we assist. Just like a normal injury you would see in an adult, we would then have a look, what is going on? What did they injure? Be it they sprained their ankle, or was it an actual fracture or that sort? And we help them through a journey to basically facilitate that healing and help them recover. Our bodies are so amazing. It actually heals on its own, and it really is just that input we give to facilitate the healing that's so important. So in the sessions, we treat the actual injury. Then we would try and preach on the rest period, because a lot of the times the kids don't want to rest or they just want to get back into their sport. And then we would work on mechanisms of return to play. So say they're a soccer player. We know that there's a lot involved. It's not just kicking a ball. There's a lot of dribbling and moving around. There's a lot of striking. So they need to be able to do that with once the injury is recovered, and that's our long-term goal. So we work towards that, treat the injury, make them stronger, prevent it from coming back, and then get them back to the actual sport that they're playing.
Okay.
And each sport is so intricate. So you'd find me now learning about rugby, whereas before I would not know how does rugby work, just because I need to know how to get this kiddie or...
So you educating yourself as well.
Yes, as I go along,
Yeah.
you get them into now what they actually need to do, because you need to know. You need to know if it's something that's going to affect their injury or their recovery. It also guides you about how can they go back in. Be it, can they go back in and just sit on the bench? Can they go back in and then, eventually play? It's really, really important.
And I want you to also maybe, inshallah, touch on the injuries per age group, possibly, and then look at how they can prevent it. Is there anything that they can do that, like, they hurt themselves, but you don't actually want them to hurt themselves? So what do they need to know when they're playing rugby, when they're doing soccer, paddle?
Yeah. So it's very vast, and I think in every age group it's very different. So we find fractures across the age ranges, because at that point they're still growing and they're developing and their bones are still growing, and especially with the growth spurts, it really affects injuries. But every age, there's no specific injury that we'd see, but what is very common is our sprains, our fractures as well. You'd find in kids that are playing, for example, tennis, you have your tennis elbow that they struggle with. So a whole lot of that we see. But I think the key thing to preventing, and this is something we liaise with coaches as well. So it's not just a physio in isolation. We talk to the coaches. We talk to the, what do they call it, physical education teachers in school, and we say, this is what the kid is lacking, and we'd find that most of the kids are actually lacking this. So with an injury, a lot of the times they've injured themselves prior, or they've sprained their ankle or whatever it is, and then you find that they keep on rolling on that side, and then it leads to a bigger injury, just because they haven't trained their balance. So after the injury, they didn't strengthen their balance, or they didn't strengthen something called proprioception, which is basically your joints basically trying to figure out where it is in space. So that's so important to train, because then otherwise, after the injury, you're just always so susceptible to a new injury. And that's something we speak to the coaches about. Incorrect form, very, very important. So some muscles in some kids are stronger than the others, or you'd find that the biceps in a lot of the kids are stronger than the triceps, because they're more with activities like pulling up their bag. You don't find them pulling against things or that sort of thing. So they're strengthening one muscle group more than the other. And with an injury, it leads to a lot of muscle imbalance. So going back into play, we educate the coaches. Listen, perhaps maybe train this a little bit more. Let's focus on doing this activity, modifying it. Or you might find in that specific age group or that specific sport, a lot of the other kids have the same issue. So that's something actually more valuable for the coach to improve on for the better performance of the kids.
So now, when you spoke about muscles and you lifted your arm up and you spoke about the kids, immediately what comes up for me are the kids' bags. They are so crazy heavy. Let's talk about that, the weight of their bags, how they're carrying it, what should be in their bags, how can they prevent not having too much in the bags. What conversation should they be having with the teacher in light of advice from a physiotherapist?
So I would say a good bag means holding it with both straps, but a nice back support. So you'll find these bags with nice cushioning in as well.
Okay, at the back.
At the back, yeah. So a nice cushioning, both straps on. You'll find kids holding it with one strap,
Just
and then
the
they
one
just,
side,
sitting in that sense. But both straps, and the weight you put in is so difficult, because a lot of the times these kids have to cram their bags in. If it's too heavy for them, we would suggest that they rather opt for a trolley bag. So, for example, I had a kiddie in that had a shoulder injury, and I told the mom, like, what bag does she have? And luckily she had a trolley bag. But the school actually assisted her in a sense to say, you can leave your books at school, just because you have the injury, and then carry around your tablet, because that school has a tablet as well. And not every school is so lucky to have that. but she was able to then modify. So depending on the child, what they need, the trolley bags are great, but a really good backpack using both straps with the back support is also not a bad idea.
Using both straps,
Both,
I think,
yes,
is pertinent in that
both,
conversation.
yeah.
We'll continue with the role of physiotherapy in pediatrics. We have Asirah in studio with us, Asirah Ahmed from Centurion, from Pretoria, and she's blocked out her time just to spend with us to talk about how the little ones needs physiotherapies in their lives from time to time and how we can prevent those injuries. She's just touched on that, but we'll talk more on physiotherapy in pediatrics. So after this, don't go anywhere. Welcome back. There is so much to talk about when it comes to physios and pediatrics, the little ones, and then we have our toddlers and we have our kids going to school. We just unpacked the bag issue. So 2 straps, watch your kids, a nice, good, firm bag on their back. And if it is too heavy, please get them a trolley bag and discuss with the school, if they can keep some of the bags at school as well, because as much as we think that it's okay, these kids are young, they can withstand whatever, but we need to look after their bodies as well so that they can use the most of it when they get older. So Asirah, welcome back. Communication and building trust with the children. I think creating that rapport with little ones. You said you need to educate yourself. If they are in a new game or a new sport, so you need to know how it's played, and you have to gain their trust. So in previous conversations, we often talk about educating the patients and how we need to know about certain things, but you need to also educate yourself. So you're a mini therapist as well. Yes. So creating that rapport with children, what is that like? What do we need to know? How do physiotherapists communicate effectively? And how can us as parents make them a little bit more comfortable with bringing a physiotherapist in their life?
Yeah, I think with kids, it's more difficult than adults because off the bat, if a toddler especially, or your babies, if they don't trust you, you're someone new, they're not going to want to do anything with you. You'd find that you're in the session for 45 minutes to an hour and they just, nope, not having it. I don't want to do it. Who are you? But the way you interact with them is so important. And it's just about having that patience. Sometimes you'll get parents that will say, no, you have to stand. Come on, the physio is saying you have to stand, you have to do it. And I'm like, no, don't worry.
They're not going to like you guys after that.
Yeah, they don't have to stand. Let's build a puzzle, and then you trick them by putting the pieces perhaps at a higher level, which encourages them to stand. So you have to be like a master of trickery sometimes, and a lot of bribing, to get them to do specific activities, but they build that trust with you. And I always found myself from a young age, I always got along with even kids younger than me. I was always on that level where I would be playing outside. You wouldn't find me inside, I would always be there. And I think that helped me to tap into, with physio, to be a little bit more creative. Okay. So I'm able to look at a situation and say, this is what the child needs, but they're not having it today. Let's figure out how to achieve it. So that trust is so important. And also just telling the parent, I know you're here for a session, but don't force them. Let's do specific things. Sometimes the parent has to step outside because you find them clinging onto the parent the whole time. And you just try and slowly build that trust with them to a point where they actually want to work with you more than anything. Or they're like, bye, mommy, bye, daddy. It's their time. You are their friend, and it's something that it's a huge responsibility as well. You holding someone else's child's, life for that seconds, or for that minute, in that session. So very, very important.
I love having shows like this because there's information that we can pull out from our medical professionals that we don't have to often have. I'm going to a GP or a physio or an occupational therapist, but you go for the treatment, you take your child, but there isn't that one-on-one because the time is limited. They have to do their session. So I'm so glad we're having shows like this. So thank you for that piece of advice. Yeah. Really, it is. So let's talk about orthopedic and muscular skeletal issues that does arise in children. What are the possible recoveries involved in that? How do you treat it? What do parents need to know? And what sort of postural problems, injuries, or even conditions like scoliosis that occurs that physiotherapists play a role in?
Okay, so scoliosis is something that we see a lot in practice, and we also see it very late on in adults as well because they didn't get that assistance when they were a kid. When you're a child, as you're growing, as you're reaching puberty, it's actually the perfect time to be able to assist in the scoliosis. And with physio, we basically focus on liaising with the orthopedic, perhaps if an operation is needed, or we liaise with an orthopod, which is basically the people that make the braces. So you must remember, if you have scoliosis, you have a specific curve in your spine. Now, if you do not have something that's supporting you, you're going to further, if you keep on, like even with your bag, if your curve is more to this side and you constantly holding your bag, you're going to further get into that curve and you grow into it until there's nothing that can be done. So bracing is basically where they create this hard cast just to keep the body upright, and they tighten it as they go along just to make sure that the child's spine starts to align a bit better. So it's not taking into account external factors of maybe your posture is bad and that sort of thing. So we work with a lot of kids and we work on stretching protocols and getting them a bit stronger. So whatever's weak and whatever's too tight, we do the opposite. We lengthen and we strengthen. And that's just to correct the curve that they might present with. So scoliosis is very, very important. Like I said, we see it later on in adults, but by then we're just maintaining it and we're trying to assist them in, just relieving the pain. With your orthopedic conditions, we even have something called torticollis, which I think a lot of people don't talk about. And it's basically in utero, so when the baby is in the tummy, they're perhaps moving the head more to one side. So what happens is they develop an injury, and when they come out of birth, it's more like the head just wants to stay to that side. So they perhaps look to one side, but not the other side. Or you'd find it's not so severe where they're just only looking to the left, and the mom or dad will be like, but why is this, like, I'm calling them but they're not looking to the other side, and you find that one side is more tighter than the other, and it's just because of their position in the uterus. And that's something as physios we treat because we work on releasing that, showing the parents how to massage very gently and stretch, and then we work on play to get them to use the other side. So instead of just turning to one side now, in tummy time, hello, here I am on this side, mommy and daddy is both here. Let's get them to use the head on the other side.
So with these conditions, whether it's scoliosis or this
torticollis,
how important is early intervention?
It's so important. Like I said, you'd find with scoliosis, we have our adults that are presenting with congenital scoliosis. This is something they had from birth, but nothing was done. So if you can really treat at an early age, you prevent issues as you get older. With torticollis, it affects the child going forward. So they wouldn't want to look in one direction, or they wouldn't want to do things on the other side. So you want to get them almost to be able to function on both sides. So it's not necessarily a neurological issue that's preventing them from turning their head. It's actually just more muscular in nature, which is something we work on.
And that's, fixable.
Yes, it is early on. So, like I see really tiny babies, few months old, even just at birth, but the mom notices this, and it's something we need to educate our parents. And also tell them there's nothing wrong in asking, because a lot of the times they'll say, like, all the new moms, they're always so frightened. They're like, what if I ask and they're going to say I'm panicking for nothing? Just ask, let us assess and let us see what's going on. And 9 out of 10 times that mom intuition kicks in and it's always correct, and there's something we can do about it.
So on that, what are the signs to watch out for when your baby's born? Because you're thinking it's just a child, there can't be these complications with just looking one side. So what should moms watch out for?
So if they have a specific head preference, so a direction, so they're only looking to one side, they don't actually attempt to ever look to the other side. Even if you are there on that side and they're not looking to you, you know that there's something going on where they're just only preferring one side. Or you find them in the cot when they're laying on their tummies, they only turn to the one side as well. That's something to watch out for. If you're more qualified, it's very difficult because when you feel they're so tiny, you can feel sort of the tension in one side more than the other. But not everyone is more like they touch is not as sensitive to that.
So So glad you brought that up.
Yeah.
Didn't even know there was a condition like that. And the earlier moms can actually see it and just ask a question. It's yay or nay.
Yes.
And then hopefully the child will be remedied earlier on.
No, definitely.
So let's look at neuromuscular disorders and what types of that. How does physiotherapists collaborate with pediatricians? How earlier on, is it picked up, and what are the solutions?
So we have a lot of this. It's a vast, like when you say musculoskeletal conditions, there's so many conditions under that. It's like an umbrella term for all of that. And we have things like muscular dystrophy, or we have genetic conditions that are so rare that are sometimes some kids are 3 or 4 in the country that have it, but it's affecting the musculoskeletal system. So you'll find that they have extreme weakness and it affects them from lifting up their head, for example, when they're a baby, keeping up tummy time, they can't even do it. They present as floppy babies sometimes, and it's just because of that muscular issue. And with physio, we work through the milestones and we help to strengthen them as they go along. So with kids like that, you'd find that they are usually delayed, but it's something that we're working towards just because of their weakness and their specific conditions. And we do liaise with our pediatricians if there's something that we come across and we're unsure of, and we send them for further tests, because it's always important to get diagnosis earlier rather than later. Then as a parent, you know how to manage it, and like I said, you're aware of the milestones and why your child's milestones are getting affected. So we see a lot in practice, and it's all about strengthening, and we use modalities like play, like I said, but in different positions to make them stronger. We get these kiddies in a pool as well, which is something a lot of people don't know. It's called hydrotherapy.
Okay.
Get them in a pool, get them to move around, but the resistance in the pool from the water is actually getting them to indirectly get stronger. And the heat from the pool is actually providing them with that relief so that they don't get that muscular pain or that fatigue. So we have a lot of things that we can do. And I think with each and every child, it's just about assessing them and seeing what is going on with them and then treating them from there correctly.
Awesome. And that's why we needed to have a part 2, because there's so much to talk about in pediatrics and the role of physiotherapists in their life with the little ones. But we'll continue. Don't go anywhere. We'll have more conversations with physiotherapists just after the short break. Back in a moment. Welcome back. Assalamu alaikum. A very good day to you. This is Life Matters, and we discuss with physiotherapists in studio with us, Asirah Ahmed, all the way from Pretoria, enlightening us with regards to the role of physiotherapists in pediatrics. And this is part 2 that we're doing. So if you've missed part 1, you can catch it on our uploads on Hilaal TV, Life Matters YouTube channel. And then also if you're watching right now and you want to tell your family, friends, and they're living somewhere across the lands and over the beautiful seas, they may do so right now on the World Wide Web via Hilaal.tv. So Asirah, we spoke about neuromuscular disorders and so much to unpack as well, a muscular condition, musculoskeletal issues. And then, there's the different type of therapies that are involved in maybe the neurodevelopmental therapies. So how important and what does parents need to know and discuss with their healthcare workers, and the collaboration of the healthcare workers as well? If you have a physiotherapy therapist come in, of course, moms and dads have lots of interest in conversations and questions as well. So, often they are too scared to ask once again. But to open up the conversation, what should they say? What should they know with regards to the collaboration of other healthcare professionals to make that comprehensive care for that child more progressive? And we spoke earlier on about being comfortable, you guys are therapists, actually, mental therapists. So let's talk about the home-based care, the neurodevelopmental therapy, and the collaboration of other healthcare professionals.
So with neurodevelopmental therapy, it's basically a technique that's very hands-on. It's done by physios, by speech therapists, and occupational therapists. And it's used to treat kids with movement disorders because of neurological conditions like cerebral palsy, stroke, and certain head injuries. So because they have this disorder in how they move, so something as simple as sitting to standing, but they do it incorrectly or they can't do it, we actually are more hands-on, facilitating those movements and teaching them how to do it correctly. We, in the session, like I said, it's so hands-on. We give them tactile stimulation, vestibular stimulation, and all that sensory input to basically show their body where is it in space. And this is how we're going to do the specific movement. And by repeating that, be it like I always like to say, there's a block at the bottom, we need to put it in a bucket on the top, but now we're going to do it in a specific pattern with them. If we repeat it constantly, it becomes a specific pattern that they can use more easily now that they're aware of how to do it. So then you'd find them doing it in the correct way as opposed to struggling or not doing it at all. So it's all about how are they moving, what are they struggling with, and how can we facilitate better movement. It's very hands-on. And it's something that you really need to do at an earlier stage. So when your child is diagnosed almost always with cerebral palsy at birth, this is something that happens at birth or in utero, we find that the early intervention is better because you're actually facilitating that movement before they develop an incorrect pattern. And then it's a bit more difficult to now get that pattern out. So with the adults that have cerebral palsy that we see at the practice, we find that they're coming in with these movement disorders that they've already now hardwired. It's already there. You know, it's very difficult to get them out of that pattern as opposed to a child who, you know, you can teach from as they're growing, from when they're smaller as they're growing up.
So when you say neurodevelopmental therapy, what comes up for me is how the brain needs to connect with
neurons.
With the development of the child. So when you're doing certain things, you're making the brain connect with the physical movements of the child.
And it's what we talk about, like I said, that somatosensory input and that tactile input. The moment you're putting a child's leg down and you're putting firm pressure, that message is going to the brain and they're able to interpret that message and then build on that movement pattern. So it's really about, like you're saying, building on and connecting the neurons, helping them as they grow to develop better.
And of course, there's the home-based program that parents need to follow up at home because you are only there a certain amount of times. What advice do you give?
Our parents, I mean, the parents that we see, like, I call them our parents because it's our kiddies and our parents, they're going through, they are the strongest people that I know, especially parents with kids with special needs. I always say that I'm strong, but they are some other level of strength. And for them, they already have the pressures of the world, of work. So to carry out a home-based program is sometimes really difficult. So what we try and do is we make it a little bit more functional, you know. For example, you are going to change your child, perhaps put the clothing further away and make him choose and walk towards it. So it's stuff that you are going to do. Maybe it'll take a minute to 2 more minutes extra of your time, but you're actually getting therapy within that time that you're changing them. Because we need to understand their needs as well as parents. So home-based care is so important. With our special needs kids, some of them are very fortunate to have carers. So most of the time we'd ask, please bring the carer along if they are carers. Let's get them involved because they're the ones 90% of the time that's going to be with the child. Or they'll tell you, this is what I'm noticing with the child. That sort of thing. So it's very, very important. Your home-based care is very, very important. As physios, we also try and get into the houses for at least one home visit. Perhaps they come for sessions at the practice, but we do at least 1 or 2 visits at home just so we can see how to maybe adapt the environment so that it's better for the child. It helps the parents. Maybe they're struggling with specific things. If they're a special needs child, for example, like wheelchair accessibility, that sort of thing, we can actually assist by going into the homes and saying, let's change this, let's try this, let's modify that,
That's actually a must.
It is.
For the physiotherapist to actually come to the home to see the environment of the child and for the whole family to be part of the process. So some children may require physiotherapy services at school. How can school-based physiotherapy services function best? And how does that actually benefit the students?
So in certain schools, there are schools for kids with special needs, and they usually have their own therapists, and they incorporate it in their timetable. So as, perhaps you don't need any therapy, you'll carry on as normal, but at a certain time, a specific child will go to physio, while the other child is going to occupational therapy. So it's part of their timetable, which works really, really well because they're getting everything that they need in their school day and they come home, and the parents don't have to do that. And because it's at school, they're getting 2 or 3 times a week therapy. We find in certain other schools, they do make some room, or crashes as well, where the parents have to drop their kids at daycare. They do make some room to say at this specific times, perhaps it's a time where the kids are playing and doing certain other things, you can come in and do the physio session. So we have to chat, and we have to also see if it's an environment that we can work in. Sometimes you go into a school setting and it just doesn't work because the child is so highly stimulated by what's around them that therapy is just not going to work. So we always assess what works better, whether it's at home, whether it's at the practice, or if it will work at the school. And then we chat to the teachers and the other therapists that's involved.
So another question that often comes up within the milestones is that my child didn't crawl, they just like stood up and started walking. Let's talk about those development questions and queries that parents do have. Is it an issue when the child is not crawling, and then what are the processes?
So not every child crawls.
Okay.
If they go straight from sitting to now pulling up to stand and standing, not every child crawls. So it's not a worry. And I think, like I said, if it's something that does bother you, more than welcome to chat, and we do an assessment and see why aren't they crawling. But it's an issue if they're not then getting to walking. So if they sitting and just sitting, or what they do is something they call a bum shift, where they just shift on their bums. That's all they do. They don't want to stand, they don't want to crawl. Then it's a bit of a worry as they get older, and then now they way more delayed in their milestones. So there's a little bit of like a gap where you can say, okay, you know what, while they're sitting and they are standing, they're wanting to walk, that's absolutely fine. There's no worry if they're not going to crawl.
Okay, so any possible advances in technology that with regards to pediatrics and physiotherapy that parents can know of, and how that can help those that are struggling?
So it's just in terms of toys and simulation. I mean, obviously, we have the iPad or a tablet, which is something which works really great in terms of getting therapy done if the child is very fussy. But we also don't want to encourage too much screen time. So then there are toys and stuff that are linked. So say you give them the tablet, but something really interesting I saw the other day, but I can't recall now. It's a form of Play-Doh, but it links to the tablet. So it teaches you how to make specific things and specific shapes and specific animals using the tablet. So if you give them that screen time while they may be perhaps standing, so they're getting standing, to strengthen their muscles, let's do it in a way where it's a little bit more functional. So they're building something. They're not just watching whatever is just coming up on their screen. So that's something that we can use as well. And sharing videos is very, very good. So in our sessions with the consent of parents, we ask them if we're allowed to share with them videos. So then we record what we're actually doing in the session. This is how we try and learn to stand them. This is how you should practice it at home. And it makes it easier for the working mom or dad who can't be there all the time. So they're able to see now, this is how I should do it at home, which ties into that home-based care.
That's so helpful, because often you look at something, or somebody explains, or even a recipe, no, but can you show me? Some people are literal, they're figurative.
And kids are so quick. They're standing,
Change
but
happens,
but they're doing it in the incorrect way, perhaps, and it's actually going to affect them more than anything. So just to make parents a bit more aware and show them what they're doing, it helps a lot.
So, Asirah, I have some interesting comments coming, and it's holidays soon, so parents want to know, how do we keep our kids busy? Screen time is coming up. So a physiotherapist professional in the industry is going to help us physically keep our kids active in the correct way. In our last segment of the role of pediatrics, the role of physiotherapists, therapists rather, in pediatrics. Back in a moment, stay with us. Welcome back. Assalamu alaikum. A very good day to you, Molweni, wherever you are. Maybe it's evening, so thank you so much for joining us as we wrap up part 2 of physiotherapy in pediatrics. We have Asirah, Ahmed in studio with us. Thank you so much for joining us once again. And it's been so interesting and so helpful to know that there are conversations, there are implementations, there are just practices that we can do and know and equip ourselves before we see the physiotherapist, after we see the physiotherapist, and even our professional doctors and stuff. So also to understand that the support that's out there, and that we can tap on, as well as as you said, the advanced technologies, using, a helpful video. So YouTube is a great, but also to connect with the correct physiotherapy with the correct information. So yes, the information out there is fast, but like you said, individualized, personalized information is also very important because everybody's different.
Yes.
I want to touch on, very excitingly, what comes up for me is the holidays that are coming up, and how kids, need to be more active. The TVs and all these apps are great to have, and it keeps kids busy, and it's an easy, process for us to get the kids out of the way while we are busy or when parents want to relax. But we also have to be safe. We have to know what are the limits. We have to know that we are in charge, and we have to control things. So please help us guide our little ones through a happy, healthy, fun, exciting time at home during this holidays. And what are the sort of limitations that we should watch out for, and how active should our kids be during this break that we hopefully will have.
Every child is different and every parent's schedule is different. In an ideal world, it would be great if we could just play with our kids, help them develop and help them grow. But I think if they're in therapy, so the kiddies that are in therapy, specifically get them to do what they have been doing in therapy, be it the specific things that they do in occupational therapy or physio, have that as part of their routine without them realizing it. So if your goal is to get your child to stand or to walk, get them to do a lot of standing activities every day. We don't want to avoid the screen time. Sometimes it's necessary, but we want to avoid it. So just be a little bit more creative in how you stimulate them. So I see the new in thing is kitchen tools that are safe for kids. Okay. So parents are teaching kids independence using safe kitchen tools. So you can get your kids to, they're hungry, they want an apple, cut your own apple using those specific things, or teach them how to pour certain things, those things that you can work with them if you're at home. And for kids that are also not in therapy, just trying to get them out and about, but finding out what they enjoy the most. So 9 out of 10 times, if you have a chat with a child, you'll sit down, they'll tell you what they enjoy. I enjoy coloring, or I enjoy kicking a ball, or, those type of things. So get them to do what they enjoy. And perhaps if you can use the neighborhoods around you, people that you are close with and you trust, get the kids to play with each other, doing things that are not involving a screen. So I think it's about understanding your child, just having that chat with them and understanding what they enjoy, and then giving it to them in a little bit of a productive way,
And also the importance of play comes in there.
Yeah.
That the neurodevelopment therapy, in a way that you are not being a physiotherapist, but you're actually just helping the child enhance through that play. You might not have a trampoline, but get on the bed and jump, and be safe with the child and hold her hand or his hand, and it's a way of associating different neurons in developing them.
And you're also developing their social skills, their emotional development. You're just giving them everything that they need when you play. And I think as a parent, you're giving yourself also a lot of stress relief. So if you just spend 15 minutes just playing with your child and actively engaging, because as much as we want to talk about kids and screen time, we are so guilty of screen time and being stuck to things on our phone. So just engaging with your child, spending that time, you'll find that as a parent, you'll de-stress more than anything. They might tell you something so crazy, so funny, that it'll make you laugh so wholeheartedly that your stress gets relieved.
Very true.
So spend that time, bond, just play with your child and help them to grow. That's something that's really important.
If they're coloring, you doodle with them.
100%.
Build something that you don't even know what you're building. Build a fort or whatever. You did such a beautiful video of, it takes a village to raise a child, and how we need to collaborate with not just our neighbors, but in conjunction, whether it's the speech therapist or whether it's the OT, and the conversations that we need to have during these holidays. What program can I continue having at home? What can I better enhance? Get on the floor. I remember my son, when he was doing OT, he had to strengthen his core.
Yes.
And he had to walk on his on the 4 feet or the forearms backwards, and put weights on. So it wasn't physiotherapy; it was play as well. So let's talk about the importance of collaborating with other healthcare professionals and how it does take a village to raise a child, and the importance of maybe listening to the aunties and the uncles, and not getting too irritated with them, but just giving the ear.
Yeah. So when it comes to healthcare professionals, we all support each other. Sometimes I'll have a case where I see a kitty and I'm treating his physical challenges, but I'm picking up that he perhaps has something that's leaning me more onto he could be on the spectrum or something else is going on. And we had an interesting case where we had a child who couldn't walk. He couldn't walk, and his parents called physio in. And we actually saw that it wasn't because he couldn't walk, he was actually on the spectrum and he had no interest in his surroundings. So, with occupational therapy and a whole lot of sessions, just by getting the OT in, he started walking. And it was not my doing, it was just that engagement in his environment. And it's so important. And with our parents who have so little time, we try and make it easier for them. So we have something called multidisciplinary treatment. And it's just involving all the professionals in one session. So if your child needs physio and OT or occupational therapy and speech, then we involve those professionals, let them get the therapy in one session. So for example, if they need to stand and they also need to work on their fine motor skills, the physio will be involved in getting them to stand and facilitating that while the occupational therapist works on their fine motor skills. And in that 45 minutes, you're getting both therapies at the same time, saving the parents a whole lot of time that they don't always have. So we lean on each other as health professionals, but we also do it for the sake of for the kids, to grow them better, to give them the best possible treatment. And a lot of the times the other health professionals know so much more that you might not know because you in your bubble of maybe physiotherapy, that just having that support from your colleagues is so important. And when it comes to the aunties and the uncles, and sometimes, like I say, like a mom always knows best, or a dad also has that intuition. And sometimes you will hear someone saying something about your child, perhaps, oh, they're really thin, or they're not like walking as yet. And I think you need to take it with a pinch of salt. If it's something that does apply to your child, something that you know, okay, it's something that's worrying you as well, then take their point into account. But if it's something that you know is not applicable to your child, you know your child's growth, you're getting the assistance for whatever it is they're being treated for, then I think you need to educate them as well and say, you know, this is what we actually
they could
do.
learn from you.
Yes, 100%. A lot of our older generation, they grew up very differently. The kids are so advanced at the moment. So we have to all educate each other, but in a respectful way. There's nothing wrong with bringing up something, but if it's applicable or not, it's for you to educate.
My dad often says, you know, raising you guys, 5 girls, we thought it was tough. But looking at the challenges that we have in today's day and age, having war literally in our hands and our children being exposed to it, the challenges of the diversity of cultures and getting, you know, to know everybody, and yes, we were I think we lived with each other and we accepted each other as is, but things are a little bit different now. So I think what comes up for me, and as we conclude, I'm listening to all these little anecdotes and these stories that you have. Is there anything that stands out for you, a success story? Because that one that you mentioned with regards to the kid that didn't even walk, or they thought he couldn't walk and it was something else, and just coming in from a different perspective, assisted, you know, aiding something else. So any happy success stories that just stands out? I'm sure there's many that stands out for you that you can share with us.
So just being able to see a child who couldn't, and there's many cases that I've had, who couldn't perhaps sit or lift up their head, now able to sit and play, or now able to stand and walk. Or watching a child who, like I said, was a floppy baby after a year or 2 years or even 3 years of physiotherapy, now able to actually stand and kick a ball. And that's something, I think you become so attached to that child, you become the proud parent. So sometimes I'd find myself, I was working with a child and he stood by himself without any aid for the first time. And I was in so much of shock at that moment. He fell, but he fell on a carpet, but he fell because we were so shocked when he did it. We wanted to cry because he did this for the first time. And he fell and he was like everything's fine, I'm good, let's do it again. And
Wow.
kids are so resilient. And I say this all the time. I mean, looking at the kids in Palestine, they are so resilient that they still have that smile on their face despite maybe their physical impairments or the fact that they've lost their parents. And kids just need that love and that support to help them grow, and we need to give it to them. And it's just sad that we can't do that for the kids in Palestine. I mean, we can help them in other ways, but love is really something that just helps kids grow.
Let us send that love and ask Allah to send our love to them. And not forgetting the kids that are here with us that we can help and assist. Take your kids to the orphanages, take them to the disabled schools, and let them appreciate what they have, just of a hand and a finger functioning. So alhamdulillah, we've sadly come to the end of the show, but I'm hoping to plan a post-COVID show with you, inshallah. We're looking forward to that, because you don't just deal with kiddies, you deal with everyone that needs physiotherapy. So we really appreciate we're doing 1 and part 2 in pediatrics and physiotherapy. Any last words quickly?
If you can do something for a child, even if it's small or big, I think you should really try and do it. There is a foundation I just want to mention called the Sweethearts Foundation, which we involved in, which takes your tops and your tags, your bread tags and your bottle tops. They collect it and they actually send it to a recycling company, which helps them exchange it for a wheelchair, be it for an adult or a kid. And those are small things that you can do. So you don't have to spend the money, even with your kids in terms of their therapy, you don't have to spend the money. It's really the small things that you do with your child or you do towards another child that will help them in the long run.
Jazakallah khair for your time. Hope to see you again in the post-COVID show, inshallah. But all the best and safe drive back home.
Jazakallah so much.
That was Asirah Ahmed. So pleased with the advices and the tidbits of information and the inspirational stories, and also that organization. Hold on to your bottle tops and the tags, the bread tags, and donate it. Even that's something small that you didn't realize that you could do as well. And of course, we pray for the children of Palestine. But stay with us for the next edition of Life Matters. We speak to Dr. Yusuf Lalkan, an educational psychologist, and he speaks on the mental health in Gaza. But from myself, wassalamu alaikum and goodbye for now.